For individuals navigating the complex landscape of diabetes management, the morning hours represent far more than simply beginning another day. These precious first moments upon waking serve as the cornerstone for establishing optimal blood glucose control, enhanced metabolic function, and comprehensive well-being that extends throughout the entire day. The choices made during these initial hours create a powerful cascade effect that influences energy levels, glucose stability, mood regulation, and overall health outcomes in ways that many people fail to fully appreciate. Consider the profound transformation possible when starting each day with clear intention and structured purpose. Rather than experiencing the unpredictable roller coaster of energy crashes, dangerous blood sugar fluctuations, and the constant anxiety that accompanies poor glucose control, imagine maintaining steady, confident control over your health from the very moment consciousness returns. This remarkable transformation becomes entirely achievable through implementing 6 scientifically backed morning habits, specifically designed to support individuals managing both type 1 and type 2 diabetes. These carefully selected practices work synergistically to create a robust foundation of stability, enabling those with diabetes to feel genuinely empowered, consistently energized, and completely confident in their daily health management approach. The beauty lies in their elegant simplicity. These aren't complex medical interventions requiring extensive resources, specialized equipment, or expensive treatments, but rather accessible daily practices that anyone can incorporate into their morning routine regardless of their current fitness level, available time, or financial circumstances. The morning period offers a unique window of opportunity because it's during these hours that our bodies naturally release hormones and begin various metabolic processes that set the tone for the entire day. By establishing positive habits during this critical time, individuals with diabetes can harness their body's natural rhythms to support better glucose control, improved energy management, and enhanced overall well-being that extends far beyond the breakfast table. Habit 1. Begin with strategic warm water hydration. As dawn breaks and your body transitions from the restorative state of sleep, it has undergone several hours of mild but physiologically significant dehydration. This overnight fluid loss, though often completely unnoticed by the conscious mind, creates a profound and immediate impact on blood glucose levels for individuals managing diabetes. The physiological stress of dehydration can trigger unpredictable and potentially dangerous fluctuations in blood sugar, setting an unstable foundation for the entire day ahead. The simple yet powerful act of consuming a warm glass of water immediately upon waking addresses this fundamental physiological need while providing multiple benefits specifically relevant to diabetes management. Dehydration directly contributes to elevated blood glucose levels through concentration effects. When total body fluid decreases, the glucose concentration in the remaining blood increases proportionally, creating what amounts to an artificial spike in blood sugar readings. This dehydration-induced glucose elevation creates additional strain on the kidneys, which must work significantly harder to filter excess glucose from the bloodstream. This increased workload can potentially lead to further fluid loss through increased urination, perpetuating a dangerous cycle of dehydration, and elevated blood glucose that can persist throughout the entire day if not addressed early and effectively. Proper hydration enhances insulin efficiency in remarkable ways, allowing this crucial hormone to function more effectively in regulating blood sugar throughout the day. When the body is adequately hydrated, insulin can more easily transport glucose into cells where it's needed for energy production. The warmth of the water provides additional therapeutic benefits by gently stimulating vital organs, particularly the liver and kidneys, which play absolutely essential roles in glucose regulation and overall metabolic balance. The liver serves as the body's primary glucose storage and distribution facility, maintaining glycogen reserves and helping to balance blood sugar levels during periods without food intake. This organ works tirelessly throughout the night to maintain appropriate glucose levels, and proper hydration supports its optimal function. Meanwhile, the kidneys continuously filter excess glucose from the bloodstream while maintaining proper electrolyte balance and fluid regulation. Warm water consumption supports both organs in performing these critical functions at their highest capacity. The temperature of the water matters significantly. Warm water stimulates digestive processes more effectively than cold water, preparing the gastrointestinal system for proper nutrient absorption from breakfast. It also promotes better circulation, ensuring that oxygen and nutrients reach all body tissues more efficiently. This improved circulation is particularly important for individuals with diabetes, who may experience circulation issues as a complication of their condition. Beyond direct glucose regulation, morning hydration jumpstarts several other beneficial physiological processes. Enhanced circulation ensures better oxygen and nutrient delivery throughout the body, while improved digestive function prepares the entire system for optimal nutrient absorption from the first meal of the day. The metabolic boost provided by adequate hydration contributes significantly to better weight management, a crucial factor in diabetes control that cannot be overlooked. Additionally, proper hydration can naturally reduce hunger sensations and cravings, helping to prevent impulsive consumption of high carbohydrate or sugary foods that could cause dangerous blood sugar spikes. This natural appetite modulation supports weight management goals, which remain absolutely essential for optimal long-term diabetes control and overall health maintenance. Habit 2. Consume a strategically planned, nutrient-dense breakfast. Many individuals with diabetes experience frustratingly elevated fasting blood glucose levels each morning, despite having faithfully fasted throughout the night during sleep. This confusing phenomenon, scientifically known as the dawn effect or dawn phenomenon, occurs when the body naturally releases stored glucose to provide energy for awakening and preparing for daily activities. While individuals without diabetes produce sufficient insulin to regulate this natural glucose release effectively, those with diabetes struggle significantly due to insulin resistance or inadequate insulin production capacity. A thoughtfully constructed breakfast serves as a powerful therapeutic tool for stabilizing these morning blood sugar fluctuations while providing sustained, steady energy for hours ahead. The key lies in understanding how different nutrients interact with blood glucose, and selecting foods that work harmoniously to prevent glucose spikes while delivering essential nutrients needed for optimal health and sustained energy production. Dietary fiber emerges as the first crucial component in this strategic approach, significantly slowing glucose absorption from the digestive tract and preventing the rapid blood sugar elevation that characterizes poor diabetes management. Excellent high-fiber sources include steel-cut oats, quinoa, whole grain breads, and an abundance of non-starchy vegetables like spinach, kale, bell peppers, tomatoes, and broccoli. These foods provide sustained energy release rather than the quick spike and crash pattern associated with refined carbohydrates and processed foods. The mechanism by which fiber works is fascinating and important to understand. Soluble fiber forms a gel-like substance in the digestive tract that literally slows down the absorption of glucose into the bloodstream. This creates a more gradual, sustained release of energy, rather than the dramatic spikes that can overwhelm the body's insulin response. Insoluble fiber adds bulk to meals, promoting satiety and preventing overeating while supporting healthy digestive function. High-quality protein forms the second essential pillar of an optimal diabetes-friendly breakfast. Protein provides steady, sustained energy without significantly impacting blood glucose levels, while promoting satiety and supporting crucial muscle maintenance. Outstanding protein sources include eggs prepared in various healthy ways, Greek yogurt, cottage cheese, tofu, tempeh, and legumes such as black beans, lentils, or chickpeas. Each of these protein sources offers unique benefits and can be incorporated into breakfast in numerous creative and delicious ways. The amino acids in protein serve multiple functions beyond energy provision. They support muscle protein synthesis, which is crucial for maintaining metabolic rate and glucose uptake capacity. Protein also triggers the release of hormones that promote satiety, helping to prevent mid-morning hunger and the temptation to snack on inappropriate foods that could destabilize blood glucose levels. Healthy fats constitute the third essential element in this nutritional trinity, contributing significantly to blood sugar stabilization while providing sustained energy and supporting numerous physiological functions. Beneficial fat sources include avocados, extra virgin olive oil, nuts like almonds and walnuts, and seeds such as chia, flax, or hemp seeds. Omega-3 fatty acids from sources like fatty fish, walnuts, and flax seeds provide additional cardiovascular benefits that are particularly important for individuals with diabetes, who face increased risk of heart disease. These healthy fats slow gastric emptying, which means food moves more slowly from the stomach to the small intestine, resulting in a more gradual release of nutrients into the bloodstream. This slower digestion helps prevent rapid glucose spikes while promoting sustained satiety that can last for hours. Non-starchy vegetables should be incorporated whenever possible, adding essential vitamins, minerals, antioxidants, and fiber without significantly impacting blood glucose levels. These nutrient-dense foods can be easily integrated into omelets, breakfast wraps, smoothies, or enjoyed as fresh salads alongside other breakfast components. Successful breakfast combinations might include overnight chia seed pudding, topped with fresh berries and chopped nuts, Greek yogurt parfaits layered with low-glycemic fruits and seeds, vegetable-filled omelets prepared with healthy oils, or whole-grain toast topped with avocado and a poached egg. The goal remains creating balanced meals that provide sustained energy while maintaining stable blood glucose levels throughout the morning hours. Habit 3. Incorporate strategic morning physical activity. Physical activity represents one of the most powerful and immediately effective tools available for diabetes management, and morning exercise provides unique physiological advantages for blood glucose control that extend far beyond the exercise session itself. Even modest amounts of daily movement create significant improvements in overall health, while substantially reducing the risk of both immediate and long-term diabetes-related complications. Morning exercise specifically addresses the dawn phenomenon by helping the body utilize the glucose released by the liver more effectively and efficiently. Physical activity enhances insulin sensitivity at the cellular level, making individual cells more responsive to insulin's signals and improving glucose uptake even when insulin levels are suboptimal. This improved insulin sensitivity extends throughout the entire day, providing benefits that last well beyond the exercise session itself. The immediate glucose-lowering effects of morning exercise occur through a fascinating physiological process. Active muscle tissue consumes glucose for energy at a dramatically increased rate, directly reducing circulating blood glucose levels through increased cellular uptake. This natural glucose utilization helps prevent the dramatic fluctuations that can occur throughout the day when morning glucose levels remain elevated and uncontrolled. The cellular mechanisms underlying these benefits are remarkable. During exercise, muscle contractions activate glucose transporters that allow glucose to enter cells without requiring insulin. This insulin-independent glucose uptake provides immediate benefits for blood sugar control, while the increased insulin sensitivity that develops over time provides long-term improvements in glucose management. Beyond immediate glucose control, morning exercise provides a natural, sustainable energy boost that effectively combats the fatigue often experienced by individuals with diabetes. Starting the day with appropriate physical activity increases overall energy levels while improving mood through the release of endorphins and other beneficial neurochemicals. These feel-good hormones not only enhance emotional well-being, but also help reduce stress and anxiety levels, creating a positive psychological foundation for the entire day ahead. Weight management represents another crucial benefit of consistent morning exercise. Even modest weight loss can significantly improve diabetes control through multiple mechanisms, and regular morning activity helps burn calories while reducing overall body fat percentage. This improvement in body composition enhances insulin sensitivity and reduces the risk of obesity-related complications that can compound diabetes management challenges. Cardiovascular health receives substantial, measurable benefits from morning exercise, which is particularly important given the significantly increased heart disease risk associated with diabetes. Regular physical activity strengthens the heart muscle, improves overall circulation, helps lower blood pressure, and positively impacts cholesterol profiles. These cardiovascular improvements can literally be life-saving for individuals with diabetes. The stress reduction benefits of morning exercise cannot be overstated. Physical activity triggers the release of endorphins while reducing levels of stress hormones like cortisol. Since stress hormones can significantly elevate blood glucose levels, this stress reduction effect provides additional glucose control benefits beyond the direct metabolic effects of exercise itself. Effective morning exercises need not be intense, time-consuming, or require expensive equipment or gym memberships. A brisk 10-15-minute walk around the neighborhood provides excellent benefits while being accessible to most individuals regardless of fitness level. Gentle stretching routines improve flexibility while activating muscles and increasing blood flow throughout the body. Yoga combines physical activity with stress reduction and mindfulness, offering multiple benefits for comprehensive diabetes management. Light strength training using resistance bands, bodyweight exercises, or simple weights helps build and maintain muscle mass while boosting metabolic rate. Increased muscle mass improves glucose uptake capacity and helps maintain better long-term glucose control. Even simple exercises like wall push-ups, chair squats, or resistance band exercises can provide significant benefits. The key to long-term success lies in starting slowly with realistic, achievable goals and gradually increasing duration and intensity over time. Consistency matters far more than intensity. Even small amounts of daily movement provide significant cumulative benefits over time, while sporadic intense exercise provides less benefit and increases injury risk. Habit 4. Implement comprehensive blood glucose monitoring. Morning blood glucose testing provides invaluable, actionable information about how effectively your body manages the natural overnight glucose release and how well your current treatment plan is performing. This daily measurement serves as a crucial baseline for understanding your diabetes management effectiveness and guides important decisions about food choices, exercise timing and intensity, and potential medication adjustments. Fasting blood glucose levels reveal critical information about how well your body maintained glucose control during the night without any food intake. Consistently elevated morning readings may indicate the need for treatment plan modifications, whether that involves adjusting medication dosages, revising meal timing or composition, incorporating different lifestyle strategies, or addressing sleep quality issues that may be impacting glucose control. The dawn phenomenon affects different individuals to varying degrees, and morning monitoring helps identify your personal patterns. Some people experience significant glucose elevation in the early morning hours, while others maintain relatively stable levels throughout the night. Understanding your individual pattern allows for more targeted management strategies. Regular morning monitoring helps identify important patterns and trends that might otherwise remain completely hidden. You may discover that certain evening meals, stress levels, sleep quality, exercise timing, or even weather patterns significantly impact your morning glucose readings. This awareness enables you to make informed, data-driven adjustments to improve your overall control and prevent problematic fluctuations. Individual responses to medications, foods, activities, and even sleep patterns vary dramatically between people with diabetes. Morning testing provides personalized data about how your unique body processes glucose and responds to various interventions, allowing you to tailor your management approach accordingly. This individualized information proves far more valuable than following general guidelines alone. Technology has made glucose monitoring more convenient and informative than ever before. Continuous glucose monitors provide real-time data and trends, while smartphone apps can help track patterns and correlations between glucose levels and various lifestyle factors. Many modern glucose meters can store data and calculate averages, making it easier to spot trends and share information with healthcare providers. The psychological benefits of consistent monitoring should not be overlooked. Having concrete data about your glucose control can reduce anxiety and provide confidence in your management approach. When you can see that your efforts are producing positive results, it reinforces healthy behaviors and motivates continued adherence to your management plan. Consistent blood glucose monitoring helps prevent or delay diabetes-related complications by ensuring glucose levels remain within recommended ranges as much as possible. Maintaining optimal control reduces the risk of nerve damage, kidney disease, eye problems, and cardiovascular complications over time. The small daily effort of monitoring can prevent major health problems in the future. For accurate morning readings, test after fasting for at least 8 to 12 hours, typically after a full night's sleep. Maintain consistency by testing at the same time each morning, as even small timing variations can impact results and make trend analysis more difficult. Be aware that factors like illness, stress, certain medications, hormonal changes, or poor sleep quality can influence readings, and discuss any concerning patterns or persistent elevation with your healthcare provider. Habit 5. Perform comprehensive daily foot inspections. For individuals with diabetes, feet require special, vigilant attention due to the potential development of diabetic neuropathy, a serious complication involving nerve damage that commonly affects the feet and can lead to partial or complete loss of sensation. Without the protective warning system that pain normally provides, seemingly minor injuries, such as cuts, blisters, pressure sores, or even small foreign objects in shoes can go completely unnoticed and potentially develop into serious infections, non-healing ulcers, or other severe complications. Daily foot inspections serve as an essential early warning system, allowing you to identify potential problems before they escalate into serious, potentially limb-threatening complications. This simple practice can literally be the difference between maintaining an active, independent lifestyle and facing severe complications that could include hospitalization, long-term wound care, or amputation in extreme cases. The importance of this habit cannot be overstated. Diabetes-related foot problems are among the most common reasons for hospitalizations among people with diabetes. Many of these serious complications could be prevented through consistent daily foot care and early identification of problems when they're still minor and easily treatable. During your comprehensive morning foot examination, look carefully and systematically for any signs of redness, swelling, blisters, cuts, scratches, bruises, or changes in skin color, temperature, or texture. Pay particular attention to areas between toes and the bottom of feet, as these locations commonly develop problems due to moisture retention, pressure, or friction from footwear. Use a hand mirror if necessary, or ask a trusted family member for assistance in examining hard-to-see areas. Check for signs of infection such as warmth, redness, swelling, or any unusual discharge. Look for changes in toenail color, thickness, or shape that might indicate fungal infections. Examine the skin for dry areas, cracks, or calluses that could become entry points for bacteria. Feel for any lumps, bumps, or areas of unusual temperature that might indicate developing problems. The inspection should be thorough and systematic. Start at the toes and work your way back to the heel, examining both the top and bottom of each foot. Don't forget to check between the toes, where moisture and bacteria can accumulate. Look at your toenails for any signs of ingrown nails, infections, or other abnormalities. Beyond the practical benefits of early problem detection, daily foot checks foster a deeper, more mindful connection with your body and encourage attentiveness to changes that might otherwise be overlooked. This increased body awareness contributes significantly to overall diabetes self-management and helps develop habits of attentive, proactive self-care that extend beyond foot health. Proper foot care extends beyond daily inspections. Keep feet clean and dry, wear properly fitting shoes and socks, trim toenails carefully, and moisturize dry skin while avoiding moisture between toes. Never walk barefoot, even indoors, and check shoes for foreign objects before putting them on. Establish a consistent routine by setting aside adequate time each morning, perhaps after showering or before breakfast, to sit in a well-lit area and thoroughly examine your feet. Good lighting is essential for detecting subtle changes in color or texture. This small-time investment can yield tremendous dividends in preventing serious complications and maintaining your quality of life and independence. Habit 6. Create a comprehensive, structured daily plan. Beginning each day with a comprehensive, well-thought-out plan provides essential structure that supports stable blood glucose levels, reduces stress and anxiety, and enhances overall well-being through improved organization and intentionality. For individuals with diabetes, morning planning serves as a crucial strategy for maintaining consistent, effective diabetes management while avoiding the complications that can arise from reactive, unstructured approaches to daily life and health management. A well-structured morning planning session addresses multiple aspects of diabetes management simultaneously and synergistically. Meal planning ensures balanced nutrition throughout the entire day, while significantly reducing the likelihood of impulsive food choices that could destabilize blood glucose levels. When you plan meals in advance, you can ensure proper nutrient balance, appropriate portion sizes, and strategic timing that supports stable glucose control. Exercise planning maintains consistency in physical activity, a crucial component of effective diabetes management that often gets overlooked when days become busy or stressful. By planning exercise timing, duration, and type in advance, you're much more likely to follow through with your physical activity goals even on challenging days. Stress management becomes significantly more effective with advanced planning and preparation. High stress levels can dramatically impact blood glucose control through hormonal mechanisms, so proactive stress management is essential. By reviewing daily tasks and potential challenges each morning, you can proactively develop strategies for managing stress, avoiding unnecessary pressure, and maintaining emotional balance throughout the day. Medication management improves dramatically with structured planning. Prepare medications and supplements in advance. Set multiple reminders for proper timing, and ensure you have adequate supplies for the day ahead. This proactive approach prevents missed doses and maintains consistent therapeutic levels that are essential for optimal diabetes control. The planning process should include reviewing your schedule for the day and identifying potential challenges or obstacles to good diabetes management. Are there meetings scheduled during your usual meal times? Will you be in locations where healthy food options might be limited? Are there stressful events or deadlines that might affect your blood sugar? Identifying these challenges in advance allows you to develop contingency plans. Goal setting provides motivation and clear direction for daily diabetes management. Establish small, specific, achievable objectives such as consuming adequate water throughout the day, avoiding processed foods and sugary snacks, taking brief walks after meals, practicing stress reduction techniques, or maintaining consistent meal timing. These goals should be specific, measurable, and realistic. Tracking progress toward these goals maintains accountability and provides a genuine sense of accomplishment and momentum. Consider using a journal, smartphone app, or simple checklist to monitor your success with daily goals. This tracking provides valuable feedback about which strategies work best for you and helps identify areas that need attention or improvement. The planning process should also include preparation for unexpected situations. What will you do if your blood sugar drops unexpectedly? What healthy snack options will you have available? How will you handle meal delays or schedule changes? Having contingency plans reduces stress and helps maintain good diabetes management even when things do not go according to plan. These 6 morning habits work synergistically to create a powerful, comprehensive foundation for effective diabetes management that extends far beyond the morning hours. Beginning with proper hydration sets the physiological stage for optimal organ function and stable blood glucose control. A carefully planned, nutrient-dense breakfast provides sustained energy while preventing dangerous glucose spikes and crashes. Strategic morning exercise enhances insulin sensitivity while providing natural energy and mood enhancement. Comprehensive blood glucose monitoring offers valuable feedback for management decisions and helps identify patterns and trends. Thorough foot inspections prevent serious complications through early detection and intervention. Comprehensive daily planning creates structure and intentionality that supports consistent, effective diabetes care throughout the entire day. The beauty and power of these practices lies in their accessibility, simplicity, and cumulative effect. No special equipment, expensive supplements, complex medical interventions, or extensive time commitments are required. Just dedication to consistent daily practices that support your health and well-being. These habits can be adapted to fit any lifestyle, schedule, or personal preferences while maintaining their effectiveness. Implementing these habits gradually, starting with 1 or 2 practices and slowly adding others over time, creates sustainable changes that become natural, automatic parts of your daily routine. This gradual approach prevents overwhelm while building confidence and momentum. Over time, these morning practices transform from conscious efforts requiring willpower into automatic behaviors that support optimal diabetes management without requiring significant mental energy or constant decision-making. The compound effects of these habits extend far beyond the morning hours, creating stability and control that positively influences your entire day and, ultimately, your long-term health outcomes. Better glucose control leads to more stable energy levels, improved mood and cognitive function, enhanced physical performance, and significantly reduced risk of both immediate complications and long-term health problems. Success with these habits requires patience, consistency, and self-compassion. Diabetes management is a lifelong journey that involves continuous learning, adaptation, and refinement of strategies. These morning habits provide powerful tools for taking control of your health, but lasting success comes through persistent daily practice rather than perfect execution. There will be days when you miss a habit or don't perform them perfectly. This is normal and expected. The key is returning to your routine as quickly as possible without self-judgment or discouragement. Remember that every morning presents a fresh opportunity to prioritize your health and set a positive tone for the day ahead. By embracing these 6 essential habits consistently, you're taking proactive, empowering steps toward better glucose control, improved energy and vitality, and enhanced overall quality of life. Your commitment to these morning practices represents a significant investment in your long-term health and well-being that will pay substantial dividends for years to come, potentially preventing serious complications while enabling you to live life to its fullest potential despite having diabetes.